The overall conditions of 124 working equids in the northern coast of Colombia were assessed during the week of September the 22nd, 2014. Thanks to local equine owner Mono Sanchez and Villa Luz's efforts, several free vaccination and deworming programs were scheduled so we could reach and analyze as many equids as possible. Donkey and mule owners in the coastal towns we visited from Cartagena to Santa Marta didn't have the worming products or general treatments for injuries or infections due to the high cost of medicine. Vaccines like equine encephalitis are intended to be annually distributed by the government to equid owners in rural areas. Yet, the community leaders expressed some concern that this has not happened in the past. Considering equine encephalitis is a disease that can be passed from equid to human by an infected mosquito, it is important that these animals are vaccinated to help decrease human infection, but also that the animals that are vaccinated are kept on record. We did not have access to previous records of which animals had or had not been vaccinated. Several animals received a topical solution to help treat wounds and lesions.
Okay, so we're in north of Cartagena and we're from the Donkey Sanctuary and we're helping assist give free vaccinations out. And they're also treating the animals as they come in. This animal's got quite severe wounds on the back, probably partly due to malnutrition. The spine's exposed quite a lot. It carries milk. If it's a very unequal load, it's probably causing the rubbing. And if the harness is fitted incorrectly, this can also cause the rubbing. It's also got a saw at the bottom there where the strap goes. That was simply just caused by using nylon, which is a really rough material. If you use something a lot softer, you wouldn't get wounds there. But it's now been treated and he's also received antibiotics. The harness was a good harness, but maybe it was just fitted incorrectly. And because it's very underweight as well, the heavy milk load, uneven milk load, is causing sores on its spine.
It did appear that the communities were very open to working with outside groups and would be in favor of more educational and management type approaches in terms of how to work or handle their animals. During the vaccination administration, a lot of the mules especially were quite difficult to handle, and there was a lot of kind of rough and abusive treatment in terms of restraint, lots of ear twitching, and more or less manhandling, so the vaccine as well as a dewormer could be injected into the neck region.
Today there was quite a different feeling with regards to the people's behaviour to the mules, donkeys and horses. When we arrived, the area was packed and it felt quite chaotic. The men were manhandling the animals to hold them steady, forcing their tails up so the animals couldn't move and twisting their ears around several times to twitch them. This was all very aggressive and it looked like it was a macho man competition. The men were laughing loudly at each other and some even kicked the animals in the face. Even the children were aggressive towards them and thought it was funny, as learned from their parents, showing little respect to their donkey, mule or horse, so an education programme would be very beneficial here. Having said this, there were no beating wounds and most donkeys and mules were above condition score 2. This was not true of the horses, which were usually between 1 and 2. After speaking with a local leader, we discovered that horses were seen as worthless, which is clearly shown here today.
The mule was thought to be the most valuable of all equids due to their ability to work harder, longer, and live more years compared to the horse. There were some malnutrition cases. This is where education may help by sharing with owners different management techniques and feeding strategies for the various equid groups. In terms of hoof care, in the countryside most of the animals were not shod, whereas in the town they were shod. Some of the cart donkeys in town were only shod with 2 to 3 nails. Education could probably help improve the current methods used by local farriers. One of the biggest problems is the handling and behavior during the vaccination administration. The use of twitch restraints could be reduced with further education in behavior and training. There is sometimes a lack of respect for the animals, and once they are old or not good for work, they are abandoned or sold for slaughter as food for crocodile farms. The community seemed very open to learning from others as they watched every step and approach we took when interacting with equids. Scheduled vaccination and deworming days are needed, as well as workshops with farriers and veterinarians. Education for both children at schools and farmers will help improve equid knowledge and respect. Overall, this region appears to have a lot of potential to continue to improve the care and well-being of the working equids with guidance from an organization such as the Donkey Sanctuary.